For thalassemia, the cure, as we understand, is by bone marrow transplant. So we have been waiting for donor for a long time. It's hard to find donor, but for sure thalassemia can be cured by bone marrow transplant. Now I have third kid who matched to donate for my second daughter as a full match. But my first daughter have no donor. So I am myself is the donor for stem cell transplant as 50% match only. But she is also recovering now.
I'm going to talk about two children from Cambodia. This is 11-year-old Ponita and 9-year-old Phimean, who had come here for their treatment. Both these girls unfortunately had thalassemia major, and this thalassemia major is a disease wherein you need lifelong blood transfusions and you develop complications because of blood transfusion and iron overload. And most of these children, most of these patients succumb to the disease in the second and third decade of life. Now, bone marrow transplant is the only curative option or the full curative option for both these children. But unfortunately, when we do HLA typing, only one of the two girls, that is the younger one, that is Phimean, the brother was a match. There is a brother who is match for this girl Phimean, but Ponita didn't have any match either in the family or elsewhere in the world when we do the unrelated donor search. But another challenge which we faced was the brother who is matching Phimean was very young. He was only about 11 months to 12 months of age, and although he was matching, but taking donor cells at this age is another challenge. So there are two important things we want to discuss about these two children. One is that Phimean, although she underwent transplant using his brother's cells, but his brother was only 12 months of age when he donated for his 9-year-old sister. Because we can't take a lot of marrow at one time, we did some innovative thing, that was we took bone marrow from this young boy at two different time points and then gave both these collections to the daughter, that is Phimean, together, and that's how she could be cured of her thalassemia. So the other girl is Ponita, who is 11-year-old with thalassemia major, but as I said, there was no fully matched donor in the family or even from unrelated donors. So what we had to do is that we used father's stem cells. Father was half match with the daughter, so we used half match stem cells to cure this girl. But being half match, there's always a problem of what we call as graft versus host disease rejection between the patient and the donor. So we again use an innovative strategy. It's first time done on a thalassemic patient in India. It's called a CD45RA depletion and TCR alpha beta depletion. So we use that technique, which is a German technique to help to purify the cells, and that's how we could use these half match cells to cure this girl as well. So in summary, we're basically discussing these two girls with thalassemia major, come from Cambodia. One girl had a matched sibling transplant from the brother who was just 12 months of age, and there was a challenge in that. The other one didn't have any full match donors, and we used half match donor cells from the father with an innovative technology called TCR alpha beta and CD45RA depletion.
The best center in Bangalore, as I know. So as I said previously, thalassemia is cured by bone marrow transplant. So here is the first option. If someone have relative or family or children who suffer from thalassemia, it's better to come here. It's my own recommendation.